Hi, this is Dr. Naidu. I wanted to go through how to correct the type 2 Grolleau deformity for tuberous breasts. So as you recall, with the type 2 deformity, the breast tissue is deficient in the lower part of the breast, both in the inner and outer parts of the breast. So if you look at it from the side, you'll see that the tissue underneath is very, very tight. And in addition, the nipple-areolar complex is quite large because a lot of the tissue is herniated into this area because the breast tissue can't grow down here, so it grows in here and it produces what we call that kind of typical tuberous form, or something that looks like a root. So that's how this deformity got its name. So to correct this, what we really want to do is we want to release this really tight tissue down here. And it's extremely tight. And we also want to do any release that we might need to do up here, although typically it's at the bottom part of the breast. And then we'll reduce the nipple-areolar complex. And we typically do like to put in an implant. And again, it's not so much for size, it's really to reshape the breast and to give more of a nice round appearance. So that's what we're doing with an implant. So if I just show you in this little drawing, what we're trying to achieve by doing that is here we've, obviously just schematically, just reduced the nipple-areolar complex. All this tight tissue that was down here has been released. So this is where we had a lack of tissue before. So we've released that. And to fill this space, we've put in an implant. And that implant is going to give it shape. And in addition to giving it shape, a nice round shape, it puts pressure on this bottom part of the breast. This is where we want all of the pressure to be pushing on that bottom part of the breast so that we don't have a recurrence of the deformity, because our tissues do have a memory. So we really want a lot of pressure here that the implant can push on here to really give it that nice round shape, and hopefully it'll maintain that shape. This is an outpatient procedure. It's done under general anesthesia in the hospital or in an outpatient center. So you're asleep for the procedure. Usually, if we're doing it just through this small incision around the nipple-areolar complex, which we can do in most cases, the procedure should take about an hour and a half to 2 hours maximum. And patients are able to go home the same day. I ask my patients to avoid any strenuous activity and really strong physical activity for about 2 weeks after surgery, but most patients are able to return to light work within 3 to 5 days. They can certainly get up and be about around the house the same day, but light work is fine within about 3 days. So for more information, please go to my website at www.naiduplasticsurgery.com. Thanks for watching.